The following segment is sponsored by CommonSpirit Health. A pain management physician could be the key to unlocking a healthier and more fulfilling life. Dr. Ancha is here to tell us more. Welcome to the show. Thank you so much for being here.
Yes, thank you for having me.
We are glad to have you. Now, you are double board certified. What does that mean? It sounds very important.
Just sounds that I've done a lot of years of training. Double board certified is because I did my residency in a specialty of anesthesia, and then I was board certified in anesthesia, and then I did my fellowship training in interventional pain, and then I went and got my board certification in interventional pain. So that's why double board certified.
Okay, so all of the schooling is what she's telling you. She has done all the schooling. She is an absolute pro. So how does CommonSpirit Health approach pain management?
So pain management is a very, very interesting and a very advanced specialty. We treat patients from all walks of life as well as from head to toe. The specialty itself is just self-descriptive, as in we manage the symptom of pain. As being part of a whole health organization, we collaborate with other specialties, orthopedic surgeons, primary care physicians, neurologists, neurosurgeons, and spine surgeons to take care of these patients and get them back to living their life.
Well, you said it, back to living their life, because we were talking about this. When you are in pain, everything else in your life suffers, right? You're going to be having a harder time at work. You're going to be shorter with your family. But being able to take care of that pain, it just opens up a whole multitude of possibilities. I'm sure you've seen that in your patients.
Yes. So pain is a very, very strong signal. You can have a chronic condition like diabetes or hypertension, but it doesn't affect you on a day-to-day basis. You're still able to go through your life knowing that, yes, I have a blood pressure that is elevated, but I'm taking a blood pressure pill and I'll go get this checked out in a month's time and see how the numbers are looking. But pain is not like that. Pain is constantly distracting you.
Yes.
It takes away energy because it activates so many neuronal channels in your brain, and there's so much energy spent in this unnecessary signal that is probably something you're not able to do anything right away about. It's activating a lot of muscle groups which ultimately fatigue, and you're not able to do the things that you want to do with your life. So yes, so pain becomes a very important symptom that patients want to address, and it's very gratifying when we are able to make that change for the patient.
Oh, I can't even imagine. And it's one of those things that pain rarely goes away by itself. We all wish that it did. But how are physicians within your organization helping with pain management?
The physicians in my organization, essentially, we sit down and talk and have patient conferences so that we can identify. Pain is a symptom that comes because the body underwent some sort of injury or a trauma, whether it is just focal or whether it is a generalized body pain, right? So the first thing that the primary care doctor does is essentially trying to identify, are there any common causes that we can identify and troubleshoot them? Is this something that's just something as little as vitamin D deficiency? Are you having an elevated blood pressure that's giving you this headache and the tension headaches or the neck pain? Trying to go through the screening process and saying, you know what, I've done the best I can. I feel like this patient's pain is not a normal symptom of something that's going on in their body. So let's send them to a specialist, for example.
I love that you do that. That you don't, if you realize that there's an issue, that you're like, you send out and make sure, because it's all about a total wellness. Now, if somebody is dealing with pain, you are obviously, you know where to go. All the information is going to be on your screen. Where can they go for more information?
They can visit the CommonSpirit Health website, as well as the information provided to you on the screen here. And if they Google my name, which is Dr. Snigdha Ancha, I'm sure we'll be able to find you more information.
And start feeling better. Thank you so much for being here, doctor.
Yeah, thank you very much for having me.